Embryo transplantation. So, what is embryo transplantation? It simply means that embryo transfer is a technique where the embryos are collected from the donor females and this is transferred in the uterus of the recipients, which serves as the foster mother for its development throughout the remainder period of the pregnancies. Now, we shall see the steps involved in the embryo transfer. The first one is called the selection of donor, selection of recipients, estrus synchronization of donor and the recipients, superovulation of the donor, artificial insemination of the donor, embryo collection, evaluation of embryos, transfer of embryos or cryopreservation of embryos or micromanipulation. So now we shall see the characteristics of the donor, selection of the donor. Superior individual performance is required. Good productive performance of the offspring. Regular cyclicity is a very necessary compound. Ovaries must be free without the adhesions. Intact tubular genitalia. Younger, it should be younger, about 4 to 8 years of the age, and healthy and should have a good body weight. So these are all the some criteria of the selection of donor. Also, it should have calved at least for 60 days back. Normal postmortem history is very required. A history of no more than 2 breeding per conception, previous calves having been born at approximately 365 days interval. Back then we saw the selection criteria of the donor. Now we should see the selection criteria of the recipients. So it should be healthy and free from infection and should have a good body weight. It should have a regular cyclicity, intact genitalia that is free from any sort of abnormalities. It should have good cyclic corpus luteum of desired stage at the time of embryo transfer. It should exhibit calving ease and that having good milking and good mothering ability. Now the estrus cycle should be synchronized. So the donor cow should be synchronized to bring into estrus or should have a palpable corpus luteum on the ovary superovulatory process. For this, any of the synchronization protocols can be used such as O-sync, co-sync, select sync, hybrid sync, heat sink, etc. Superovulation of the donor cow. So the procedure for increased ovulatory response by administration of hormones, that is the gonadotropins hormones, to produce several ova instead of one, which is normally produced at each estrus. So this large number of ova is later on fertilized and the embryo produced can be transferred to the recipients. So the basic principle of the superovulation is to stimulate the extensive follicular development through the use of hormone preparation, which is given SG with follicular stimulation hormone activity. At what time the superovulation should occur? For optimum response, gonadotropin treatment is initiated during the mid-luteal phase of the estrus cycle, that is on the days 9 to 14 of the estrus cycle. Day 0 is estrus. So the donor cows can be superovulated repeatedly at approximately 6 to 8 weeks interval. So next we'll move on to insemination of the donor. A donor should be inseminated artificially 2 to 3 times at 12 hours interval after the onset of the estrus. This is required because ovulation can occur over any extended time period. A fresh semen is preferred. If it is frozen, then use double insemination dose at each insemination process. Embryo recovery can be done with two types. One is surgical and other one is non-surgical. Surgical method. Most often used in sheep, goat and swine through the mid-ventral incision under general anesthesia. The method can be performed on day 3 to 4 after estrus in sheep and goat 8-cell embryo or less, and on 2 to 3 days after estrus in swine 4-cell stage. So now we'll move on to non-surgical method. This is commonly performed in cattle, buffalo and mare. It involves 2 or 3 ways Foley or Voerlin catheter which allows flushing fluids to pass into the uterus and at the same time allows fluids to be returned from the uterus to a collecting receptacle. A small balloon near the end of the catheter can be inflated just inside the uterine horn to prevent the flushing fluid from escaping through the cervix. So we shall see the procedure now. First collection of bovine embryo should be made at 6 to 8 days post-breeding at compact morula or the blastocyst stage. 6 to 7 days post-ovulation at the blastocyst stage in mare. The blood flushing medium for embryo collection is most of the species is modified ubiquitous phosphate buffer saline or normal saline can be used. During final collection, oxytocin level is administered. So, given large doses of intrauterine antibiotics to prevent infections. Injection of PGF2 alpha is also recommended to speed recoveries of ovaries and to prevent pregnancies if viable embryos are not disclogged by the flushing. So, how the evaluation of the embryos is done? After the collection and before transfer to the recipients, the embryos are evaluated under stereosome microscope at 50 to 100x magnification. Day 7 bovine embryos, compact morula or blastocyst stage are about 150 to 190 μm in diameter and are still within the zona pellucida. Embryos are graded based on the following characteristics: compactness of the cell, regularity of the cells, variation in cell size, color and texture of the cytoplasm, presence of vesicles, excluded cells, and cellular debris. Embryos are evaluated for their state of development. Stage 1 is called the unfertilized egg, Stage 2 2 to 12 cell, Stage 3 early morula, Stage 4 morula, Stage 5 early blastocyst, Stage 6 blastocyst, Stage 7 expanded blastocyst, Stage 8 hatched blastocyst, Stage 9 expanded hatched blastocyst. Stage 4, 5, 6 embryos are best with the freezing procedures. Transfer of the embryos to the recipients. Recipient should be in estrus within 12 hours of the donor so that it should possess good corpus luteum at the time of the transfer. To maximize success rate of the transfer, the recipient estrus should be in sync with that of the donor. Process of transferring embryos. The recipient is palpated to determine the presence of location of the CL, that is the corpus luteum, which is in the right ovary versus left ovary. The recipient is administered an epidural to relax the muscles in the pelvic area. Next, we'll move on to the surgical method. It involves laparotomy incision preferred in the sheep, goat, and that of the pig. The uterine horn ipsilateral, that is to the same side of the ovary where the corpus luteum is exposed. A small syringe is fitted with 21 gauge needle is used for the transfer. When the embryo is placed in the uterus, the needle is carefully inserted through the wall of the uterine horn, whereas when the embryo is placed in oviduct, then the needle is inserted through the infundibulum into the ampulla where the embryo is deposited. Non-surgical method. This is mostly used for cattle and the mare. Flushed embryos after the inspections are loaded into the ET straw. If the embryo is frozen, it is thawed in the warm water bath for about 920 Fahrenheit for 30 seconds and placed in the ET gun and covered in a sterile sheath. ET gun is passed through the vagina, cervix and into the uterine horn on the side as corpus luteum. The embryo is deposited one-third the way up to uterine horn. The pregnancy rate is high when day of the estrus of the recipients and the donor are within the 24 hours. So now we shall move on to the storage and the cryopreservation method. Embryos can be maintained at near body temperature in the media used for flushing during the period between recovery and the transfer. If the embryos are to be held for longer than 2 hours up to 10 hours, a media containing 20% heat-treated serum should be used as a holding media. If embryos are cooled at 50 degrees centigrade, that is, it is a refrigerated temperature, they can be maintained for about 2 to 4 days. Cryopreservation of embryo is performed for a longer period of time. Back then we saw the embryo transplantation in the cattle. Now we shall see the embryo transplantation in human. Embryo transfer refers to the transplantation of a mammalian pre-implantation embryo into the reproductive tract of a recipient female so that it may be implant and continue to develop to birth. Embryo transfer thus refers to a step in the process of assisted reproduction in which embryos are placed into the uterus of the female with the intent to establish a pregnancy. The first step is the egg harvested from the ovary, then the eggs fertilized in the lab with the sperm, and the embryos undergoes a number of cell division, blastocyst stage, morula stage, etc. And these embryos are transferred into the womb. Conditions for the embryo transfer. Difficulty occurring during conditions such as ovulation disorders, damage to the fallopian tubes, endometriosis, premature ovarian failure, uterine fibroids, genetic disorders. impact sperm production, etc. So there are mainly four types of embryo transfers. One is the fresh embryo transfer. Once eggs have been fertilized, they are cultured for 1 to 2 days. The best embryos are chosen to transfer directly to the woman's uterus, which is examined by the microscope as we saw earlier. Frozen embryo transfer. Any healthy embryos that were not used in the first transfer can be frozen and stored for the future use. That is, they can be cryopreserved. These can be thawed, that is, they are heated and transferred to the uterus. The next one comes the blastocyst embryo transfer. If many healthy embryos develop after the fertilization, it is common to wait to see if embryo develop into blastocyst. According to a study in the Indian Journal of Clinical Practice, blastocyst embryo transfer has a higher success rate than the standard embryo transfer on day 3, although it is highly debated. The next one comes the assisted hatching before the transfer. Performed just before the embryos are transferred into the woman's uterus. Using a laser, the embryologists make a tiny, precise opening in the shell of each embryo, after which it is transferred. Now we shall see the procedure. An embryo transfer is the last part of the in vitro fertilization IVF process. During the IVF, fertility medications are used to stimulate the ovaries into releasing healthy eggs, as we all know. These eggs are then removed from the woman's ovaries and then it is fertilized in a lab. Once the fertilized eggs have been multiplied, the doctor chooses the best embryo to transfer to the womb. Embryos are then placed in a soft catheter and are injected in the uterine cavity through the cervix. For a pregnancy to begin, the embryo must then attach itself to the wall of the womb or the uterus, which is called implantation. The transfer of the pre-implantation embryos may be accomplished either surgically by making an incision through the abdominal wall and exposing the uterus, or non-surgically by gaining access to the uterine lumen through the vagina, the latter being more common. The doctor inserts a speculum into the woman's vagina to keep the vaginal walls open. Using ultrasound for accuracy, the doctor then passes a catheter through the cervix into the womb. From there, the embryos are passed through the tube and into the womb. The process is usually pain-free and rarely requires any sedatives. Embryo transfer is most commonly performed after 72 hours. Blastocyst transfer is generally performed at 120 hours, that is the day 5 post-retrieval period. Thanking you all.